Hi everyone, today our video is about role and functions of mental health nursing. Here the role of mental health nursing is nothing but the scope of mental health nursing which the nurse can be act within the healthcare delivery system. Okay, here the roles of mental health nursing includes the primary mental health nurse, registered psychiatric mental health nurse, nurse generalist, nurse specialist, community mental health nurse, psychiatric home care nurse, forensic psychiatric nurse, case manager, tele-nurse, nurse researcher, psychiatric nurse educator, nurse administrator, and nurse pharmacologist. Okay, here the primary mental health nursing is nothing but the nurse who is working with the other healthcare team, and she will be helping the healthcare team to diagnose and treat the psychiatric mental ill person. Okay, and a registered psychiatric mental health nurse, which the nurse provides the psychiatric mental health care to the individuals, families, and groups, and enable them to function at optimum level. Okay, and the nurse generalist is the licensed nurse providing mental health care, and the nurse specialist is the clinical nurse specialist who is having the masters of degree in a psychiatric nursing. Okay, and next community mental health nursing is a nurse who is helping the diagnosis and appropriate referrals and rehabilitations of the mentally ill persons. And psychiatric home care nurse is a direct patient care, which means the nurse will be helping the mentally ill persons in a behavioral management and crisis interventions, and also she will be counseling the mentally ill persons. And forensic nursing is nothing but the nurse works with the individuals who have entered in a legal system. And the psychiatric consultation, that is counselor. Okay, and here the nurse will be act as a counselor, and she will be giving counseling to the mentally ill persons as well as to the family members also. And next, coming to the case manager, she will be acting as a advocator in this case manager, and she is going to coordinating the care about the patient within the healthcare team. Okay, and the tele-nurse is nothing but the nurse who is providing the health information, mental health information about mental illness. Okay, through the telecalling. That means she will be going to using the telephones or internet or something. It can be electronic things. Okay, and nurse researcher is the person who is going to conduct the research to know about the new mental health illnesses or something what she wants to be find out. Okay, psychiatric nurse educator. So psychiatric nurse educator is nothing but the nurse who is going to educate regarding the psychiatric illnesses or a treatment. Okay, and the nurse administrator is nothing but the nurse who is acting as an administrator within the mental health delivery system. And the nurse pharmacologist is nothing but the nurse who is going to maintain the medical management, that is the medical support to the mentally ill person. Okay, and next, coming to the functions of mental health nursing in a various settings. So here we have a different settings in a mental health delivery system. So the settings includes the inpatient department, outpatient department, ECT treatment settings, daycare centers, child psychiatric ward, home settings, community mental health centers, hospice care centers, and medical inpatient ward. Okay, so the functions of mental health nurse in a inpatient psychiatric ward includes providing calm and safe environment to the patient and perform physical and mental health assessments, promotion of self-care activities and medication management, assisting in a therapies, observation and documentation of behavior, and delivering the psychoeducation and counseling the patient, and cooperation with the other mental health team members, and teaching social skills and the stress management strategies, and planning of discharge and community referrals. So these all the functions will be included in an inpatient psychiatric ward. And next thing is psychiatric outpatient department. So the nurse has to do in a psychiatric outpatient department includes performing clinical assessment, assisting for the mental health assessment, providing the psychotherapy or a behavior therapy, counseling the patient and the family members, and conducting group therapies. Okay, so these are all the functions the nurse is going to do in an outpatient department. Next in a settings includes ECT treatment settings. So ECT is nothing but the electroconvulsive therapy. So the nurse has to do in this setting is includes teaching the patient prior to the ECT treatment. That means we need to give information about the ECT treatment to the patient as well as to the family members, and preparing the patient for ECT and providing care during the procedure, assisting with the post-treatment. Post-treatment is nothing but the after the procedure, what we need to give care to the patient. Okay, and providing reassurance to reduce anxiety and delivering psychoeducation regarding ECT. Okay, next settings includes daycare centers or day hospital. So in these hospitals, the nurse has to do is day treatment, that is the treatment which is included for day. Day treatment is included the treatment which is planned for the patient within the day. So that within the day treatment we need to give to the mentally ill person. So next thing is clinical assessment and observation and documentation of mentally ill person, medical management and teaching social skills for the patient, and counseling, providing occupational and recreational therapy. So this occupational and recreation therapies will be given for the patient to divert the patient mind. That is, we are going to support the patient with through the recreational therapy. Okay, and the next setting is child psychiatric ward. So in this ward, the nurse is going to do the assessing for a psychological need of the child and determine the strengths and abilities of the child, and develop care plan, monitor child's developmental levels and speech therapies, providing safe therapeutic environment, and teach adaptive skills. So adaptive skills are nothing but teaching, dressing, grooming and toileting. Okay, so next thing is home setting. So home settings includes assessment of symptoms, teaching patients and families regarding hygiene and the relationship between the physical and emotional health. Okay, and next one is stress management and daily living skills, medication management, appropriate referrals to the community agencies, and provide supportive counseling and promotion of mental health and prevention of mental illness. Okay, and next setting is community mental health centers. So in this, the nurse is going to do as identification of patients in a community. So within the community level, she is going to find out the mentally ill persons, okay, and refer the patient to the appropriate hospitals, and home visiting and providing direct care and follow-up care also she is going to do. Okay, conducting public awareness programs. So we need to conduct the programs within the community to gain the awareness within the population, and management of care plans and coordinations. Okay, and next thing is hospice care centers. So hospice care centers are nothing but the helping the cancer patients or terminally ill individuals, okay, and provide supportive psychotherapy to the patients. And at last, medical inpatient ward. So in this medical inpatient ward, the nurse is going to do the psychological interventions for a chronic illness with a major psychological effects. So the patients who are having the chronic illness, they will be having the psychological depression or any psychological abnormalities. Okay, so the nurse is going to assess for a psychological abnormalities, and she is going to give a therapy which is related to treat the patient. Okay, so this is about the information regarding the roles and responsibilities, that is functions of mental health nurse within the different various settings. I hope you all are understood. Thank you everyone.